Hospitals in rural communities are suffering because PPE is expensive. There's all this price gouging that you can't barely afford some of the things we need as doctors and nurses to take care of patients. And also, some hospitals are closing.
Exactly. And, rural health hospitals entered COVID-19 already in across the board some precarious financial positions. And the pandemic has impacted rural hospitals in two primary ways. One being worsening their financial health as facilities, and the second making it very difficult to acquire the needed supplies and equipment to take care of patients. On the financial front, generally, virtually all small and rural hospitals in March stopped elective procedures to curb the spread of the virus. This was the right thing to do from a public health standpoint, but these elective procedures represent a significant proportion of revenue for these facilities. And you mentioned price gouging. Absolutely. I talked to a CFO of a small rural hospital this summer, and he said that before the pandemic hit, one box of gloves would cost anywhere from $3 to $4. Now that price has increased to between $20 and $25 per box of gloves.
This is just, to hear at a time where this is a life or death situation for not just patients, but also for healthcare providers. And to hear that people are capitalized on it by gouging and that there's not some kind of universal approach where we at least keep the prices where they were, because we're trying to buy equipment to save people's lives, and the idea that manufacturers are raising the prices or can't manufacture enough of it is so frustrating on so many levels. Dr. McKinney, the other part of it also is people have to understand that when a hospital closes, that affects the entire economy of a rural community, right?
Oh, absolutely. Our hospital in our community is one of the largest employers, first of all. And then, of course, if you are a business that's coming into a community, you want to know that your employees and their families will have health care when they move to that community. So we've seen that around us in neighboring communities, that their rural hospitals have closed and their populations dwindle, their businesses go away, and it really makes a huge impact on the community itself.
I agree. And, when I think about, this pandemic, it certainly has revealed significant healthcare challenges in rural America. The first is around how do we recruit a sufficiently sized and adequately trained rural health workforce, number one. Number two, the pandemic has further revealed and accentuated significant health disparities that exist between our urban and rural communities. The 20% of Americans that live in rural America across the country are more likely to die from heart disease, cancer, and stroke compared to their urban counterparts. And lastly, on the financial front, there are states and the federal government that are now experimenting with new financial models, new ways of paying rural hospitals in predictable and sustainable ways. And these experiments very much need to continue.
Absolutely. Well, Dr. Hughes and Dr. McKinney, 60 million Americans, fellow Americans, live in rural areas. And this is a very serious problem. And it's one that they have to take seriously, that those in the cities have to take seriously. And people have to wear their masks and not pretend that this is a hoax, and keep the burden off of the very weak and small hospital systems that are trying their best to keep up. So thank you for sharing your stories with us, and hopefully people out there will realize it's not just about themselves, it's about everybody. Thank you so much.
Thank you.
All right.
Thank you.